want to be treated equally, not identically.
Today's guest is the director of the Alliance for Physicians Leadership at the University of Texas at Dallas, and also my friend. I would like to introduce to you retired Colonel Don Taylor. Thank you so much for being here.
Glad to be here, and thank you for the invitation.
Yes. So I know that you have a very varied background because you haven't always been in healthcare. I know that you've served in the military, but I know that you also got your degree in architecture. So let's back it up and tell us about your career, and then tell me, please, what you do now.
So yes, it kind of started, I grew up in the Dallas-Fort Worth area. Architecture was just a means with a scholarship to go to school. But I was fortunate that I had a military job as I departed. Further fortunate that I was assigned to a medical organization in my first assignment as an architect. And I specialized in medical facilities. That led me to this journey of discovery about how do you design facilities, how do you create a population, how do you move further, and then that allowed me to go further into management, policy design, even serving in the Iraq War, commanding a trauma center, and then departing there. But I've been in healthcare off and on for 40 years or so.
Impressive. So what are you seeing on the healthcare side of things? You know, I had the benefit of getting your eyes on my manuscript for my children's book, and it does talk a lot about point system, a reward-based system, and intrinsic motivation, but it stood out to you from a healthcare perspective. And so what are you seeing from a health perspective that a reward-based system could work?
So when I read your manuscript, it was very clear to me, and I understand your motivators behind it, and I was thinking, how could we create a similar gamification or motivation module for people to focus on their own health needs? Healthcare and health has been confused, I believe, over time. We live in a nation where healthcare seems to be the buzzword, and we've been taught that health can't be achieved without healthcare. Somewhat true for what I call one-on-one or individual needs, certainly an injury or others. But in general, the overall health of populations, the health of communities, is best achieved through better behaviors, better choices of individuals. We're not taught that. We're not taught that because the industry itself somewhat disguises that, in my belief, in the interest of either profits, the business side of healthcare, and or the government intervention, which is more about power and control and using it as a means by which to influence peoples. You sort of immunize yourself to all that influence if you're healthy, and particularly younger in life. We just have to change the way people make choices.
How do you think that we could help them change? I mean, I think that if I think about the question or a statement that we need to be healthier, that's really a broad term. And so that could mean 1,000 things to a bunch of different people. So how would we incentivize them towards health then, if that's such a broad term?
So first of all, the delayed gratification from healthy choices is really delayed. You really don't reap the benefits of that till later in life. Younger populations tend to behave as they want to and can certainly sustain a perception of health, but they're establishing risks later in life, of which they think somebody else will take care of that. Or there will always be a technology or a science or an intervention in the healthcare space to do it. We've also been taught to live essentially with chronic conditions managed, assuming that's equal to health. And the healthcare system, from a business perspective, is quite happy with that. It generates plenty of revenue for them.
Well, sure.
Insurance companies are quite happy with that too. And the insurance companies have positioned themselves over time to not cover just the what I call catastrophic events, but now they manage or insure you for primary care, for basic services. I always compare it to I teach pre-med undergrad at UT Dallas as well, and I say, it's like your auto insurance. Do I pay insurance to change my oil and change the tires? No. I buy auto insurance for a car wreck. Mm-hmm. Why do we pay for things we don't need in healthcare? Why can't we introduce the market in the primary care side for prevention and for wellness? And you would start paying for that. They're not covered as well. We also don't teach it within our own communities, with our own families, within our unique cultures, about healthy behaviors, healthy choices. It's just not encouraged because we're just not a nation that focuses on that.
That's true. What do you mean by paying for prevention?
So what if we had primary care, for instance, that was focused really on the health outcomes of a population rather than reducing or measuring the processes toward reducing health care. I rarely see a system that measures health, because if you achieved the reduction of disease, if you achieved health, you reduce your business under the current compensation models. We're moving there in what they term value-based care, which is risk-based care where you're capitated with an amount of money, but still it's usually later in life are they focusing on that. They're not focusing on it early in stages. And we don't have a connected system in our country, and I think COVID introduced us to that, where we found way too much variation in the way we pursued public health. Variation in counties, communities, states across the nation. And that goes right into our public schools even. Health isn't taught the same way in public schools. And I think we've conflicted health, quote unquote, as a different narrative. Mm-hmm. We have to be careful that it's truly physical and emotional health that we're trying to pursue. And I will add, we diminish the emotional health needs of our population too. We hide it or we don't address it earlier in life.
That's a good point. I mean, there still is quite a bit of shame that's wrapped around emotional health. So how can we start moving that needle? I mean, I think I hear your statements about the business that's created around a poor health vision that people have. And maybe that's what we need to talk about too, is how can people have a vision for their health? But I hear you talk about the business that supports the way that things are run right now. And it makes me wonder then, who can we get to help support moving that needle at all?
Right.
Because they're motivated for their business. And then how do we get attention on it?
Well, it's hard to get attention on it because, first of all, because the money is there's so much money in the industry. The narrative is continued. Just look at the pharmacy ads you see on television today. That's influencing people to ask for particular meds.
True.
For conditions they may or may not have, but they perceive they may have. Mm-hmm. And so that is purely financially motivated to try to get patients rather than the physician to ask for a particular medication. And it conditions you to think that, of course, I have all of these things I need help with. We haven't taught them, when they were in their 20s or teenage years or even in elementary school, how do you make better choices about your daily needs? How do I prepare myself, first of all, to be an emotional side, to be resilient? Mm. Sometimes we don't do that well. And I learned in my military command days, we have a generation of children today who don't take bad news well. They don't know how to recover from disappointment because they've been sheltered from that in many ways. That causes crises because when things go bad, it's an immediate, rapid response to disaster rather than, okay, how do I just brush myself off and get over this? And so you have to, my experience was you have to sort of parent them through tough days with trust and nurturing. And we're not doing that today. So a generation is over-responding to, sort of social stimuli. And I think it's created aggression. It's created no hope, less trust. And that also creates the lack of kindness that I see that we have in our society today. All of this is related to health to me. All of it's related to health. And during COVID, it just manifested itself. It just revealed itself. We've got so many lessons from COVID we should learn. We just don't have the political will to stop and learn the lessons. We want to move on to another problem that can be used effectively.
Yeah, that's it. That's remarkably insightful about what has already been going on. And I'm wondering, when you're working with these pre-med students or in the Alliance, are there ways that you're talking with them about maybe educating their future clients or
Yes.
the community? Maybe getting involved in some kind of advocacy. Is there a way that they can start talking about health differently?
Well, the physicians, yes, in the physician program that I'm in, they're more senior physicians. They're moving from their clinical world into leadership roles. And so our program really develops their business skills, but it also develops their individual leadership skills and introduces them to concepts that they really haven't had to face or deal with in most of their clinical careers as physicians. Now, in the undergraduate side, it's a different story because they're younger, brilliant young people who are motivated to achieve. And they're heart-based, so they're clinically focused, and they have an inherent compassion. It's different than just a business education. These are folks who want to serve others. So I do a unique little exercise with them on the first day of class. I'm a little bit unique in that I don't allow technology in my classroom at all. No phones,
yes, I love
laptops,
it.
nothing. Pad of paper and a pen. And
During the whole class?
During the whole class.
They have to take their notes by hand?
all by hand.
I bet they hate that.
They do. Until the end of the semester, and then they thank me for releasing them from having to be on the phone. So, but the first day of class, they have to handwrite a half page to me why I choose to serve others in healthcare. And I have hundreds of these stories. And it's amazing what they reveal. Some say, great question, I've never asked myself, and here I am a senior. And others go, I don't know, I was told I had to become a physician.
Oh.
And then I had one young girl who was second generation from Vietnam. And she said, I found my father, when I was 11, I found my father in the tub in an alcoholic coma. I called 911. The emergency responders told me I saved his life and that I was a hero.
Oh my goodness.
She said, that moment is what I want to recapture.
Oh, I have goosebumps.
Yeah. And she said, now my dad has recovered from his demons, she said, and he's my biggest champion.
Oh.
And so she said, I need to go change the lives of others. So those are stories I like people to stop and reflect on. And I like to take them through that journey. Sometimes in my senior class, I read some of these to the senior physicians and go, do you remember your moment? And so, part of the program is about business, but part of it's about this emotional need to care for the people and their health, not just give them health care.
I appreciate so much that you are kindling that fire that it's already burning in these undergraduate students to want to take care of other people, and you're just really igniting that for them. I love that. And I'm wondering, okay, so now how do we bring that back home? How can people at home be helping their children or maybe even just their close family to have a better, stronger vision of what they want for health so that they can work towards it?
Correct.
Instead of combating, kind of playing bop-a-mole with all the symptoms and, taking whatever we need to take just to address pains or ailments.
I saw that in your book, though. See, I see the potential in your book, in a version of your book, to capture the concept and just lay out the basic principles of health, physical and emotional healthy behaviors. Encourage that with gamification, with reward systems, and then talk about it openly with your children. And so that they get rewarded for helping others, they get rewarded for teaching others, they rewarded for giving back, they get rewarded for showing or telling someone they're proud of them, a peer. You imagine a second grader walking over and saying, I'm really proud of what you did today? How powerful is that to that other child?
It'd be life-changing.
It doesn't happen, though. It doesn't happen. We need to do more of that and become role models. Even at that age, be a role model. Your concept of gamification could help with that. And I think these reward systems could do that to incentivize good behaviors. Yes, I want you to do things like clean up your room. Those are all self-discipline things. But also, how can I become a great member of society for the rest of my life? First, be healthy. Be a role model for health. Be a role model for sound emotional health. Be a role model for doing things the right way. You're immediately a leader when you are.
And how powerful it can be to be that living example even at 5th grade.
Yes.
That'd be so amazing to even watch that, the ripple effects that could happen from a child standing up for their own vision that they have.
Right. And it establishes their credibility, their presence, their leadership already at a young age.
I love it. I love it so much. Do you have tips for people at home to start incentivizing their kids? I see so much correlation when it comes to money and health and,
Yes.
nutrition, not just, your overall health. I love that you brought up the emotional health aspect. Do you have tips for people at home that may not already have a kind of awareness about good nutrition or about how to motivate their kids to have a healthier lifestyle, maybe even physically, or resilience you talked about?
Well, I think you have to do the research, and then establish what's healthy within your own culture, with your own family. What is it you're willing to, that sticks within your faith or within your traditions? I've always said that health really doesn't start with you or your child. It starts with before your child is born. It maybe even starts with your grandmother teaching you what to eat and how to eat. So that we have these generational kind of shifts to do things. And we bring the generational health into this as well. And I think we need to do more of that. Number one, it would help create patterns of behavior that sticks within a family. And the second, it would connect the generations again, which is a whole other discussion that we have problems with today.
Oh, yeah.
But I think there's ways to do it. Just do research. And there's plenty of, let me just say, pressures to not live healthy lifestyles. There's plenty of what I call noise today in our space that would discourage collaboration, kindness, and partnership. You just have to steer away from that. Decide.
And I'd like to play a little devil's advocate, because I think there's plenty of room for excuses. And I don't usually like to use the word excuses, but more like we have reasons why we might not pay attention. So if the parent is already so busy juggling soccer schedules, planning dinner, we're working full time, we're taking kids to doctor's offices, whatever, all the things, why is it important for parents to take an interest in researching how we can be healthier and teach our kids about health?
Prioritize. What could be more important than the long-term investment in your child's emotional or physical health? Prioritize. You're given only a limited amount of time. Prioritize. And those moments create a bond or a relationship that's much stronger, maybe than some activity. Just prioritize.
I love that. Well, thank you so much for your insight and perspective. This was very enlightening.
Thank you. Thank you for the time today.